they were concluding, you would understand that like business, that's a sector that's not easy to deal with the situation we are facing now for churches and synagogues and mosques and temples to reduce the number of people who come in as part of implementing those measures. It's very, very difficult. But we had a very good meeting with them this morning. The second thing I would like to say is that I have met yesterday with the leaders of political parties, all political parties represented in the Gauteng legislature, the ANC, the DA, the EFF, the Freedom Front Plus, the ACDP, the IFP, attended the meeting that I convened yesterday morning. They are in full support of all the measures that our province has put in place in order to implement the announcement made by the president when he declared the national disaster on Sunday. So obviously, we have been pretty concerned about the impact of all this COVID-19 on the economy, and we are seeing it's already having an impact in various parts of the world. Dr. Masuku will later take you through just all the interventions we are making to reduce the spread or curb the spread. He is the leader of the team of the Provincial Executive Council that's dealing with comprehensive measures. But I also set up another team of MECs, 3 MECs, that's looking at the economic side of it. The MEC for Economic Development, the MEC for Finance, and MEC Panyaza Lesufi. You will receive, in a short while after my remarks, you will receive a presentation. We have our team of economists in the province have already been doing work. And this session we have with you as business leaders is very important to help us factor the full picture. They've already been doing work to look at how we are going to be impacted and how we are already impacted from an economic point of view by looking at who we trade with. It is very important for us as the leadership, the leaders of various sectors in Gauteng province to understand why Gauteng is going to be uniquely impacted and quite more severely impacted. We are vulnerable. And there are several reasons, at least 5 reasons why our province will be vulnerable. So when you look at all the numbers that are coming out, the more infections happen. They've just announced 202 today from 150 yesterday. Expect that there will always be larger numbers from Gauteng. And there is a simple reason, an objective reason. The first one is that we are a port of entry from a point of view of air travel. So OR Tambo International Airport, as you know, is the biggest airport in our country, but also OR Tambo is an aviation hub of sub-Saharan Africa. There are many people who fly to different parts of the SADC region through OR Tambo. So when air travel has been identified as one of the critical factors for the transmission of this virus. A lot of the cases we have had in our own country, a lot of them are people who have traveled and it's principally air travel, but we now have cases, yes, of local transmission. The second reason, other than being an aviation hub for sub-Saharan Africa, we also have the large concentration of foreign diplomatic missions in our country. In fact, this is often something South Africans don't appreciate, that outside New York, and possibly one, outside New York and another, Washington, we have the largest concentration of foreign missions and diplomats in our country. And where are they located? In Tshwane, in Pretoria. So you know the nature of that, their work is, they're moving in and out. It's the nature of their work. And so that's an important factor, because the transmission of, if you discount what is now happening, local transmission. The third reason is that we are an economic hub of South Africa. And go just beyond that. We are an economic hub, an industrial hub of sub-Saharan Africa. So goods and people, movement of goods and people in and out of, and through Gauteng. Sometimes goods that come from other areas arriving at our ports, Durban, into sub-Saharan Africa. All that comes through Gauteng, into the other centers, right up to Zambia, the DRC. So we are very integrally connected with and the economies of the various SADC countries. Those economies very much are dependent and networked to the Gauteng economy. In addition to the fact that we are an economic hub of South Africa, that there are more people who move in and out of our province into the other parts of the country, where we also pose a danger that if we don't contain, if we don't escalate the measures and contain the spread here, in addition to the things I've said, is that we can become a source of spreading this virus to the other parts of the country. And when Easter is coming, like it is coming now, you know what happens during Easter. A lot of people move out of Gauteng to the different parts of the country. The numbers are low now in those regions such as Limpopo, Mpumalanga, Free State, Northern Cape, Northwest. But if we don't do extraordinary things here in Gauteng, so the national government also understands that if you want to contain the urban hubs like Gauteng, KwaZulu-Natal, and Western Cape, those urban hubs are critical. That we have to, that's where there's another factor, there's large concentration of people. Gauteng province, as you know, has 15.2 million people. 1 out of every 4 South Africans you meet is likely to be coming from Gauteng. So we are a high densely populated province. 25% of South Africa's population is located here. And given all the other earlier factors I have indicated, we are an aviation hub, we are an economic hub. If you add that to population density and go to the next factor, which is human settlements. Some of the human settlements and the public transport systems move millions of people. Our public transport system moves millions of people on a daily basis. And we know that the research points to the fact that the public transport system is also a very important area where if we have an outbreak of an epidemic, that's where you're going to have a lot of infections happening. So densely populated, especially the informal settlements and the townships, So once this pandemic now, because it has been declared, it has moved from just being an epidemic to a global pandemic. Once it moves into these densely populated areas like the townships and the informal settlements, the numbers will shoot. And we also know that it is in those areas also where these issues around hygiene measures, washing your hands every day, in some of the areas there may not be adequate water. Some of these measures that are being introduced, applying them, social distancing, just social distancing in those areas would be very, very difficult. We also have organizations, civil society organizations like churches that are big themselves. They are big gathering places because we are a densely populated province. So that's why the meeting we were having with the churches now, that to get them to understand 100, even though the science of 100 is shifting in many parts of the world, they are reducing those numbers lower and lower and lower. They may have started with 1,000 in some parts of the world. They are reducing them lower and lower as the pandemic gains momentum. Our country may be headed in that direction, where even as we are now, we are less than 100. We may go for a situation where even that is no longer allowed. But that's a function of national decisions, because we are led by our president. Everything we are doing, we are led by our president to say, now this is the step where we are, these are the measures, and then monitoring every day what's going to happen. So, and when we talk about the economic impact, so because we are an economic hub, so the economic impact will be felt severely and immediately here, because the Gauteng economy is also very globally connected. We are a highly globally connected economy. Something that happens in any part of the world at the scale it is. Already we were feeling China. When China did the lockdown, we were already feeling China. What's happening with Europe, the epicenter now of this pandemic has shifted to Europe. You know, our trading, in terms of our trading partners, major trading partners, the trade volumes between us and some of the major European economies, what happens there has an immediate impact on us from a global trade point of view, but also and then the impact on small businesses. Some of the measures we have put in place may become quite a big challenge. And obviously we called you here very conscious that we are just a provincial government. I don't want to raise an expectation that a provincial government can deal with issues that are belonging to the national sphere. For example, yesterday already, the Reserve Bank has dealt with an important issue about cutting the interest rates. So there's no provincial government that can cut interest rates. There's no municipality that can cut interest rates. It's only the Reserve Bank. So there are a lot of other national issues, whether it's on the economy or on the measures that were announced by various ministers. A lot of them have to be dealt with at a national level. But we know that the full impact will be felt at a lower level in our provinces, in our cities, in our residential areas. That's where the jobs are. That's where the businesses are. And especially small business will be very, very hardest hit. And we know that the global trend and the South African trend as well is that the big companies in the last few years, the big companies, yes, may retain jobs, but they are no longer the key driver of employment. It's the SMME sector where new jobs in a significant scale So the major employers, yes, they have the numbers, they may help us retain those. But if you really want to drive significant economic development in our country, is the SMME sector. But the SMME sector would be immediately hit in a very big way by this situation. So we called you today to also start a conversation that will enable me. I preside over what is called the Provincial Command Council. So the president leads the National Command Council. Every province and premiers in those provinces lead the Provincial Command Council. And they must engage various sectors. That's why today we were meeting with the religious sector to also understand their problems. They raised a whole list of issues with me, but when we concluded the meeting, they were saying to me, Premier, all being said and done, we must be part of the efforts to save lives and reduce the impact of this pandemic. And we don't want to be sides of transmission, sides of infection, and simply insist that no, our churches are big. So they were very, very helpful, but they raised other things that we will raise, we will be able to take to the president about. And many of the churches said to us, because you will hear when Dr. Masuku speaks on the health implications, that we may reach a point where there are more people who are infected and then who need to be treated. It's one thing to be infected, that 80% of those who are infected, it's mild, who are in the stage of mild. But when you get to severe, that 15 to 20% where now people are severe, they've gone beyond that, the fact that they've got the virus, they need to be treated. Depending on the pace, and we are looking at what's happening in Italy and in Spain, versus what happened in China, in Singapore, in Japan, we are looking at, we may reach a point where we need more facilities than we have at the moment, and where people may need to be quarantined who are infected, where people may need to be treated who are at that stage where they must be treated. And we just hope, because you are business people, I can't say and pray, but I added this, and pray that the situation doesn't get there, because think of what the impact would be. If it gets to a point of shutting down, a total lockdown, from a business point of view, is that it is jobs, and it is businesses. So the one thing that everything needs to be done to ensure that we get to taper down the infections, what's called flattening the curve, to avoid getting to a point where you kind of at a point where you have no other alternative. How you get to that point and how you avoid that, there are many calculations that have to be made. And I'm hoping that also business organizations at a national level have an opportunity through the business working group to interact with the president. But today I thought, let me and my team of MECs charged with this responsibility just interact with business to hear the voice of business. Part of hearing the voice of business is, where can you help? What are the available capabilities? We want supply chains to continue to be in place. We don't run short of supplies, the essential supplies, including, this thing that worried us a lot about the stockpiling of food, people rushing to go and buy. The other thing that worried us a lot about just the price increases. There are a lot of citizens who have been sending me messages who were showing me that what a bottle, maybe 20 mils of a sanitizer bottle was costing just a week ago, and what it costs now. From one of the citizens sent me, she used to be a member of our legislature from the Democratic Alliance sent me what used to cost in a locality 120 milliliters of sanitizer used to cost 174 rands. So she showed me that no, it's now 314 rands from 100 and she just said a week ago this was 174 rands. Now it is 314 rands. The Minister of Trade and Industry yesterday was also talking about the engagements that national government, that's the right level, has had with businesses, including retailers, just on this issue of price. Because we know that when there is a crisis, even of this magnitude, you know, for some it may just be a business opportunity. You are business people. You know, somebody may just see that, oh, things are running, everybody needs this thing. But when we face a crisis of this magnitude, and this is just an emergency and a disaster, we need to make sure we move together as various sectors. So what I am interested not only in sharing with you what our team, the MECs and our research team of economists says, but after that I want to hear from you. I'm told some of you arrived here at 12:30. You were here early, and I really appreciate that. You even had to break for lunch. You've been waiting for us. We really appreciate that. We don't take this for granted. But in the end, when we leave here, we want to also hear from you as business leaders to be able to say, how do we brace this together? How do we face this situation together? And what are some of the things we need to think about? Because you can't think about all these measures if you also don't engage all the sectors. So I really appreciate your presence here this afternoon. It's a Friday. Normally in business, you are not in meetings on Friday afternoon. You are doing some work on Friday afternoon, but the last thing you are doing on Friday afternoon is a meeting. Am I correct? Yeah. You rather change your day to be doing something. And business, this is also shifting, impacting on how our business is going to operate. So putting in place those measures, how many can you afford as a small business to have people who are working from home? What will that require? The big corporates, I think they are very well positioned. They know, they have organized their work, they do remote. But small businesses, and sometimes with small businesses, how do you minimize social interaction? And sometimes with small businesses, that just social interaction is one of the core things you've got to do because of the nature of the work, the nature of your business. So this session we have will help us just to also understand that as government. I want to tell you, as the Premier of Gauteng, I can't promise you bailout. That will just be populist, you know, people who go around. I have no money to bail you out. But I can do a lot with you, including amplifying your voice about the impact of this. But I also want those of you who say we have something to offer. We need national government to look at that, but we also can work with you, Premier. Some of the businesses have been phoning me. I won't say the names. They are saying to me, Premier, we have this, we have that. We can help here. Normally, if you need facilities, we would normally charge this, but we know these are tough times. Or we are going beyond our call of duty. We would normally do only this for our staff, but we want to offer this and that. It may be issues around testing centers. Others may even say, there's a business that said to me that, no, we will want to focus on where there's shortage of sanitizers. We can assist. So there are many, many things that businesses can do. This emergency requires that for the sake of our future, for the sake of the future of our children, and also for the sake of the aged, because the aged are the most vulnerable. The most vulnerable, this thing has been put out there that by all accounts, that because of the weaker immune systems and many other, including that men, the science of it, which Dr. Masuku, that men are more vulnerable, especially those who smoke. But also we must be able to get out a message to the youth. The youth mustn't think they are invincible and then think that, no, they must go on partying because they are going to bring home. They're going to bring the infections at home and infect their parents, the older people who are not so, whose immune systems are already exhausted. So that's why all the measures, including these extraordinary measures of the social distancing and reducing, shutting down the places that where young people sometimes like to go and hang around. So those are extraordinary times and they need extraordinary measures. So, but my input to you is that we need you and you need us to brace this. We don't know how long this will take, but it does seem like if you take your heart on yourself and feel even harder beyond what we have put in place, if you do those things, you may able to help taper down the infection rate and start knowing what are you dealing with. All we are dealing with at the moment is that we are receiving new numbers because people continue to interact. And as I said earlier on, we know where the source is. So Gauteng province can't just respond like any other province because we are the most vulnerable. When it comes to the economy, once the economy is hardest hit, it is this economic hub as well. That's the most vulnerable. South Africa's economy cannot recover if we in Gauteng don't do extraordinary things. So those are my remarks, and thank you so much. I would like to give can you do this in 15 minutes, Muzi? I want Muzi to share with you some of the crunch numbers that our team has done, the team of economists has done, just on the preliminary sense of the impact on the Gauteng economy. I want Muzi to be healthy, so when we give him the mic, we will sanitize it as well.
Thank you, Premier. Am I audible?
Yes.
Thank you, Premier, for your address, as well as remarks. On behalf of the collective that is here, or as a collective, we cannot begin to express how honored and privileged we are today, as you have really set the tone around the challenges that we are facing in light of this pandemic. Indeed, you have set the appropriate tone, calling for us to look at extraordinary measures that we can implement in ensuring that our economy doesn't collapse. Muzi, you have your marching orders, 15 minutes. I hand over to you.
Thank you, Program Director. Premier, MEC is present, colleagues from provincial government, and most importantly, leaders from businesses, gateways of the economy. Thank you for taking the time to be with us. As the Premier has indicated, we are part of a team that is basically leading some of the economic work that we as the province have to basically roll out in order to address this. So what we've prepared for you this afternoon is basically a sense of what the likely economic impact will be and the sectors that are likely to be affected, as well as some of the interventions that we are currently simulating in order to be best prepared for this unprecedented once-in-a-lifetime crisis. But just as a quick recap, What we do know is today is the 83rd day of the COVID-19 virus. The first case was really on the 29th of November from China. For a while, it was mostly seen as a pandemic that is localized, that is centralized within Asia. But what has become apparent is that this is a pandemic that is global. In fact, as of Tuesday, we had more cases outside China as compared to China. What we do know today, the latest data shows that we've got approximately 250,000 cases in the world. 202 of those are in South Africa, of which around 110 are in the Gauteng city region. Unfortunately, the data we have at hand shows that 9,900 people have lost their lives. This is basically the spread of what COVID-19 has been throughout the world. So the transmission pace that has occurred is it moved from the eastern side of the globe to the western side of the globe, and now with the numbers coming in, it's now filtering to the southern side of the globe, which is the rest of the African continent and ourselves as well. In terms of the growth rates, this slide really summarizes where we are in terms of the growth rate of deaths and fatalities of COVID-19. Initially, when you look at death rates per million people in a population of the country, we do see that the highest death rates per million population are currently in Eastern Europe, in Western Europe, and Western Europe has really been placed as the epicenter of the pandemic. But when we further unpack the data and we look at death rates per 1,000 infected people across the globe, what we are seeing developing is a trend where countries with less stronger health systems are showing higher death rates per 1,000 people infected. So what this data really shows us is, for example, countries such as Ukraine, Guatemala, and the Philippines have got death rates in excess of 10% of infected people. As I said, part of the risk with this type of modeling is that this is a disease that's only 83 days old. But as the data evolves, we are seeing different information. But what we are clear about is that countries that have deaths of infected people but have fragile health systems are showing higher than the global average of about 3% death rates of infected people. Just to bring the message home, so as of today, we've got 202 people infected, of which 109 of those individuals are in Gauteng. We are 20 days into our first COVID case. If you remember correctly, our first COVID case was on the 1st of March, so today is officially the 20th day. And on the 20th day, we have 202 infections. We have tested 6,400 people in South Africa. This is quite low considering what the testing rates in the rest of the world is. I mean, the United Kingdom is now at 25,000 tests per day. So there's still a lot of work to do in terms of testing as well as procurement that is related to the testing or equipment. As I said, I'm speaking in my capacity as an economist, so as such, I'll move away from the health issues. One of the key, what is very clear is that the transmission mechanism of COVID-19 economically will be through trade disruption and the slowdown of movement of people and goods and services. And what particularly becomes a challenge for us as Gauteng is that 90% of our imports or goods and services that we get from the rest of the world are concentrated in basically Asia, Europe, and North America, which are currently the epicenters of the virus. So we expect that the transmission mechanism, basically in terms of weakening our economy, will come mainly from declining demand for our commodities from those countries, but also as well as from reduced supply from those countries as well, from most of the commodities that we use for manufacturing and that you as Gauteng suppliers use to produce the goods and services that you trade. So that can be framed as the first transmission mechanism that is likely to weaken us. The second one basically is restrictions on limited business and tourism travel. This is likely to be the fastest transmission mechanism through the tourism sector because it's basically a complete collapse of any movement throughout the world. And then the third, which is more of a non-economic impact but a social impact, is basically the rise of hysteria, the rise of behaviors that are not normally associated with the long-run average. We've already seen these affecting financial markets. We are going to see these affecting secondary markets such as panic buying, cancellation of sports events, which has already crept in the rest of the world, and other panic-related behaviors. So in the rest of the world, these have been limited to cancellation of sports events, etc., etc., cancellation of school events. We are yet to know how those behaviors will filter through to populations within Africa, where there's high inequality and resource distribution is quite disparate. So I'm just going to walk us quickly through some of the challenges. One of the key challenges we've had is that over the past 30 years, Chinese production and manufacturing is heavily reliant on Chinese production. So about 15 years ago, China accounted for about 12% of global manufacturing, and today, or at least before the COVID virus hit, it was accounting for about 30% of manufacturing. So manufacturing in the world was heavily dependent on China. So disruption in China was basically the first knock-on effect that the global economy felt. But now that it's no longer just a pandemic that is confined to the Chinese economy, it's now in the Western Europe economy, in the American economy, this sort of transmission mechanism can be expanded to think of perhaps 80% of global production and manufacturing in the world coming to a collapse or a slowdown. As of last week, the IMF basically revised the global growth drastically by at least 0.4 percentage points of all major countries. But as of yesterday, our Reserve Bank revised South African growth by 1.2 percentage points from 1% to negative 0.2. So we no longer have the burden of anticipating whether we'll have a recession. We definitely are in research territory. So this COVID-19 is basically going to slow down our economy to negative growth rates drastically. And that will have meaningful impact to you as business owners and also to us as public officials who have to distribute service delivery at a certain cost. If one had to try and frame it into 3 building blocks on what is perceived as the 3 scenarios. We do have 3 scenarios at hand. One is a quick recovery scenario where the virus comes and goes and China picks up manufacturing, Western Europe picks up manufacturing, and North America also picks up manufacturing very quickly. The other is basically what was first deemed as the global slowdown case, where the global economy slows down for a fair amount of time, and eventually we do see within 3 to 6 months some sort of pickup in production from all key sectors. But all these scenarios were based before the World Bank announced this as a pandemic. So as of last week, this was a pandemic, and for a while the pandemic case was seen as the worst case scenario. So chances are we need to revise our spectrum of what is good, best case, worst case, and fair value in terms of this pandemic. Currently, what the indications we have and the data that shows us that basically we're likely to see China pick up production to pre-COVID-19 crisis maybe in 2021 Q1. And that's the best case data we have now, and that data could evolve dramatically if you factor in collapse in Western Europe as well as North America. In terms of sectors that are affected globally, I'll touch on the Gauteng sectors shortly. So the tourism and hospital sector, the aviation sector, the automotive sector, oil and gas, consumer products, consumer electronics. In the interest of time, I trust as business people that you have been following the news and you have an intuitive understanding why these sectors are being greatly affected. So as much, I won't really delve into why there is a total collapse or why these sectors are vulnerable. I think for us, what's important is really mapping which sectors in Gauteng are vulnerable, because as a trade open city region, our vulnerability is quite unique. So I'll just touch in terms of 3 regions where we get our goods and services. The first is China. So since 2014, we have traded 1.8 trillion rand worth of goods and services with China. And 76.9% of those goods were basically bound for Gauteng or came from Gauteng suppliers to China. So we basically account for 7 out of 10 goods and services that come from China or go from South Africa to the rest of to China in this country. So that means basically China trades with Gauteng, and then 30% of that then goes to the rest of the country. And then if you basically try and map up what it is that we trade with China. So what leaves Gauteng is basically mineral products such as ore, slag, iron ash, mineral fuels, and coal and nickel. So a total collapse in Chinese demand, as I said, means basically appetite for these goods and services is basically has thinned away. Also, what comes from China to enter the Gauteng city region is basically electric machinery, capital equipment, vehicles, OEM equipment, and articles of steel. So a collapse in Chinese production basically means that these goods and services have come to a halt. So key value chains that depend on these, or sectors that depend on the production of, or on the supply of these goods and services from China, are basically at 100% risk. The same story is accentuated when you look at our trade with Eastern Europe, Western Europe, sorry. So Western Europe is our largest trading bloc. We trade 3 times as much as we trade with Western Europe compared to what we trade with China as a country. And the bulk of our trade with Western Europe is really concentrated around advanced manufactured goods such as capital equipment, vehicles, as well, of course, our precious minerals. What we get from Western Europe is components for our OEM manufacturers, capital equipment, as well as vehicles and advanced machinery. So you see our exposure to Western Europe and China really affects our manufacturing sectors, as well as sectors that do sell these goods and services. Similarly, with North America, we have a similar exposure to goods and services in the manufacturing sector, in aircraft, in nuclear, in capital equipment, and in photography and in vehicles. When we unpack basically our exposure to China, we do find a very what I'll say a heightened trade to goods that you not normally think of. So what this infographic shows you, for example, 50% of all umbrellas that we buy in Gauteng, we buy from China. 43% of all rail stock that we procure or import from the rest of the world, we import from China. 39% of all electronic machinery and 30% of all toys and games we get from that. And most of these goods and services are goods and services that are bound for the retail sector or are components of some sub-manufacturing sector. And the same trend becomes accentuated when you look at Western Europe. Printed books come from Western Europe. OEM equipment for our motor vehicle and auto vehicle supply chains come from Western Europe. So we do this assessment basically to dig deeper which sectors and which value chains will be sort of affected. So we didn't want to have an approach where we just give a generic perspective. And we do the same as well for say North America, to see how exposed we are. So in light of this assessment, what we are currently looking at is basically, I think a very important aspect is if you look at the third point, say in Western Europe, 63% of all our pharmaceutical products we get from Western Europe. And that's quite important coming to what we conclude as sectors at risk for the Gauteng economy. Naturally, this being a health pandemic, the impact on the health sector is at the forefront. So just to give perspective, we currently have approximately 17,500 beds in Gauteng, and our city region is likely to be overwhelmed if managed measures are not immediately put in place. And from what we see so far in the past 83 days is the best resource health systems on the planet are even struggling to cope with this pandemic. So we therefore expect shortages in supply constraints on the health sector. But these will need to be managed with agility from public-private partnerships, as public sector alone cannot match this. Another linked sector to the health sector is basically the pharmaceutical sector. So China and India are significant producers of raw materials used in local production. What is concerning at this point is that India has announced trade restriction to COVID-19 related input products for export, and this will greatly affect our pharmaceutical sector. This is over and above the exposure of Western Europe that are highlighted, where 53% of all our pharmaceutical products come in Gauteng are imported from the EU. So we do expect a great degree of pressure in the pharmaceutical sector. Naturally, the bulk of goods and services that are highlighted from China find themselves in the retail and wholesale sector. So basically a decline in inputs into that sector is going to lead to lower margins and basically pressure in that sector, leading possibly to job sectors in that sector. That sector is quite important because apart from the public sector, it's the largest employer in the country. Capital equipment, which is quite exposed to manufacturing from China and Western Europe, plays a key role in construction of electricity, gas and water sector and various boilers that need to be constructed for that sector. So that sector is greatly at risk as well. Also, we do expect some sort of impact on subsectors in manufacturing, such as railway stock and stock components. A key sector which will be impacted is obviously the financial sector. As we speak today, the JSE, the Johannesburg Stock Exchange, is currently at 2012 levels. I think close to 7 trillion rand has been lost in the JSE over the past 30 days. And this is due to combined shocks of the pandemic as well as oil price related geopolitical tensions. However, there's a likelihood that rising default rates in the financial sector from both businesses, households and smaller businesses will put bank balance sheets into significant pressure, and that pressure on that sector will basically filter through to the rest of the economy, possibly to what we saw in the 2008 crisis. Naturally, a sector that is very important for us as Gauteng is the auto sector. So as I say, the EU and the US account for 41% of all vehicle imports into Gauteng, and additionally 60% of all our OEM imports come from that region. So basically, collapsing global supply chains will basically affect this sector drastically. This is a key employer of advanced skills and advanced manufacturing in the city region, so we are quite concerned about that. We also are likely to see an impact on sectors that are reliant on advanced manufacturing and electrical manufacturing. Naturally as well, because our ores that we are basically famous for in the Gauteng city region find themselves basically in East Asia as well as Western Europe. A collapse in appetite of any mineral ores is basically going to hurt the labor impactful mining sector. I think the other most important sector that will be affected by this and is being affected by this at a quicker rate than all the other sectors you've highlighted is the tourism sector. But basically to paint a picture of why tourism will be hit hardest and quickest than any other sector, this infographic basically gives you a perception of countries throughout the world that have basically shut down their skies, whether it's total quarantine, total travel bans, or some sort of significant measure of limited flight. Basically, this is the rest of the world has basically shut down the skies. And if you look at where our tourism visitors come from in South Africa, the first 8 of those come from countries that have been hit severely by COVID-19 and have either totally shut down or have reduced significant traveling. So it is likely that we are going to see a total collapse of any sort of travel from those sectors. But over and above that, our local sectors, such as the restaurant sectors, are likely going to basically implement social distancing to basically limit activity in those sectors. And these are also significant employers as well as a significant source of income. So the tourism sector, from our perspective as Gauteng province, is perhaps the most immediately vulnerable sector, apart from the other manufacturing sectors that we've highlighted. What we've seen to date is that governments throughout the world have come up with various measures, and those measures can really be categorized into sort of like 3 pillars. Monetary policy measures, these include drastic monetary expansion and unprecedented reduction in interest rates. I mean, I don't remember the last time I had 100 basis points reduction. Injection of liquidity into economies, but we've also seen extraordinary fiscal policy measures, such as increased government spending to prevent, detect, control, and treat COVID-19, wage subsidies to people and firms to help curb contagion, expansion and extension of transfers and grants to vulnerable population groups, tax holidays and tax relief and businesses in vulnerable sectors. But I think caution to the wind, as Premier said in his remarks, I think we have limited fiscal options as a provincial government, but we'll look to our national leadership in terms of this sort of implementation of both fiscal and monetary measures. But then the most important measures that have been put in place are really health-related measures that limit the interaction amongst peoples, and these are social distancing measures, basically from cancellation of common and major social events, social curfews, putting a limit on the number of people that are expected to interact, as well as work-from-home measures being implemented in sectors where that capacity exists. we as the provincial government have also been at the forefront of trying to see how best we can respond to these type of measures. So we've put together the team that I'm part of, which is basically the modeling team. And the purpose of this team really, apart from the preliminary work that I've just presented to you, is basically to be very prescriptive on what to do in each of those vulnerable sectors within the ambit of what we as a provincial government can implement, but also to solicit some sort of input from you as a public sector, private sector, on where you can assist. So we are modeling and quantifying risks and job losses and business closures per sector, per vulnerable sector that we've identified, driven by supply chain issues, cash flow, liquidity challenges. We're also measuring the fiscal budget that we as a province have available to see what we can shift and optimize. Bear in mind that we have approximately 142 billion in the purse, and which we'd prioritize for other goods and services, but we're in the process of trying to see how we can still shift in the ambit of still delivering vital service delivery, but also addressing the pandemic that faces us. We're also in the process of developing stimulus responses in terms of how our spending, our regulatory policy might need to change in order to basically meet this. There'll also be other issues that we need to address and have answers for you, such as how we'll shift our public procurement patterns to make sure that sectors or businesses, particularly small businesses, will be able to be capacitated to meet some of the production challenges we will see in key sectors such as the health sector and the pharmaceutical sector. I think I'll leave my presentation here and hand over to the program director. Thank you so much. Premier, thank you.
Thank you, Muzi, for the presentation. Because the South African economy, and by extension the Gauteng economy, has not been functioning as a closed economy, we remain vulnerable during this pandemic, and we shall be severely impacted. Muzi has outlined the potential and absolute impact from a global perspective, the South African perspective, and the Gauteng economy. And whilst we deliberate on these scenarios that he has painted for us, it is equally important to have an appreciation of the impact from a social perspective, and in particular from a health perspective. And on that note, I would like to call upon Dr. Masuku, who's our MEC for Health in the Gauteng province, to address us. Thank you, Dr. Masuku.
banned state coming in. There's some flights from risk areas and reduce entrance from seaports. We also have made sure that we ban the gatherings, social gatherings of over 100 people to be prohibited, including churches, including all the other actual spaces. We also have bans on taverns and shebeens. I think it has been on the headlines. I don't know why, but it's been on the headlines that there's a limit now in terms of the number of people there and the time that liquor would be served. And this will be enforced. Yesterday, I saw our community police was in action in shutting down one of the places in downtown Johannesburg. Education, all the schools, ECD, and universities have been closed. And it's something we are going to assess as we go until after Easter to assess the impact. Correctional services, also the visitors are not allowed. In this space, we also have, as a health department, also reduced and pronounced on the regulations just to reduce the traffic into our facilities. We call upon our retail just to reduce their trading hours. The health response, we're increasing capacity and also just reducing the traffic into our facility. Just downscaling our service just to be able to deal with the emergency service.